Have you ever wondered what happens when your blood becomes too alkaline? Alkalosis can be a metabolic or respiratory issue. In this video, we explore respiratory alkalosis. This can impact our health significantly. Respiratory alkalosis occurs when breathing issues lead to low levels of carbon dioxide in the blood. When CO2 levels drop, the body's blood phase rises, making it more alkaline than normal. For instance, hyperventilation is a common cause of respiratory alkalosis. In fact, studies show that anxiety can lead to rapid breathing and trigger this condition. To compensate, the body reduces bicarbonate levels to balance the increased pH. This response is crucial, as severe alkalosis can lead to muscle spasms and other issues. Understanding respiratory alkalosis is vital for recognizing its symptoms and effects. So next time you hear about alkalosis, you'll know how it relates to breathing.